Mega Man, Jimmy Easy. Come on.
Welcome to Advocacy Help Desk, a network of advocacy leaders sharing best practices and new ideas via this free podcast to help everyone in government affairs get better at their advocacy craft and having a lot of fun while doing it. Now to today's great show.
Welcome, everyone, to another great episode of the Advocacy Help Desk. Thank you for joining us again today. As you guys know, we are available at advocacyhelpdesk.com. I am your co-host today, Brian Fratkin, CEO of Spark Influence, an industry-leading PAC and grassroots platform. As always, at the Advocacy Help Desk, we are here to answer your questions and to provide you just with experts in the industry, right? We've been very lucky to talk to a lot of different folks in a lot of different places in their advocacy careers who've talked to us about acquisition or mobilization or innovation or whatever it may be. And today we've got another on the innovation, creative design kind of how do we get people involved and what can we do to be creative and innovative? And I'm super excited. But first, to get there, I'd like to introduce our co-host today, Nick DeSarno of the Public Affairs Council. If you're not a member, you should absolutely be a member if you're in our space. But Nick, it's great to see you. Good to see you in England again. Tough to give away with the underground sign behind you. Yep, there it is. But good to see you, Nick. Welcome again to another episode.
Thank you so much, Brian. And I'm really excited today because we have one of our council members on and someone who actually won an innovation award at the Advocacy Conference, which will be hopefully one of our first conferences back in January. Hopefully everyone gets vaccinated and this Delta thing goes away. Yep. I'm pretty positive because in the UK, we kind of got the Delta, variant first and India as well. And we've, obviously they're still struggling here a little bit, but we've kind of overcome the big spike and it's a very steep downward trend here in the last couple of weeks. And things have been opening up. So there's some positive news there. So hopefully it doesn't last too long in the US. But I'm excited to have Erica Klinger, who is the Senior Director of Marketing for the Association of Accessible Medicines. AAM is kind of the trade association for generic drugs in the US, and she can probably explain who they represent better than I can. But I'm really excited to have her on because she has constantly been, from a kind of strategic standpoint, really someone who keeps upping the game in terms of digital marketing and really putting digital advocacy first. And so I always follow what Erica's doing and seeing all the cool stuff that she's worked on, whether it's kind of Instagram campaigns or fun things that just get people talking that are a little bit outside of what you normally see in the Beltway. That partly probably because Erica has a lot of experience outside of the Beltway in general in doing marketing and working for foundations and other nonprofits. And so with that, turn it over to Erica. I don't know if you want to just give a little intro about yourself, if I missed anything, or about AAM before we dive into the questions.
Thanks, Nick, and thanks, Brian. I mean, this is a really fun opportunity, and I love kind of sharing some kind of, my perspective anyway, and hopefully it's helpful for others. I started when I came to DC about 5 years ago. I started working for the Association for Accessible Medicines. And as you said, we represent the manufacturers of generic medicines, which are basically the competitors to the brand pharmaceuticals, where 90% of prescriptions filled, but we're the low cost, we're the accessible medicines. So most of the time patients can fill their prescription at less than $20. So one good thing if you're working in advocacy is find, a community of people that are passionate and advocate and have something that you need. So it's very, we have a network of over 200,000 patients across the US, which I've slowly built through our digital channels, through our advocacy. And it's really, really interesting to watch and feel every day that they're helping and their voice is really advocating for other patients out there to make sure that their drug prices stay low. So that's what we do. A lot of our members do make brand pharmaceuticals as well. We also do biosimilars, which are the competitors to the biologic drugs, which are the specialty medicines that are really the high cost medicines. So a lot of the buzz on the Hill right now is try to bring down those costs. And biosimilars and the Biosimilars Council, which is part of AAM, we've been actively talking about, and I'll share some cool campaigns about that. But my background really has been in digital and creative. I have a real startup background. For the first 5 years after graduating college, I worked in a web startup. So really building websites, building apps, application developments, coding. And then when shifts started happening, where it really came clear to me that you could have the best website or app or product that you build, and if you don't promote it or understand promotional channels and digital channels, you'll never get anyone there and people won't be using it. So creating digital experiences and cross-channel experiences. So not only do I work in digital, but really how do you connect digital to what people are doing every day? I think that's really been a sweet spot for us as an association. We're only 30 people. So we really, really rely on our partnerships and, working with, like the Public Affairs Council we're a member of, as well as our consultants that we work with and our creative partners. So it's not just me, I have a team of people behind me. But like you mentioned, our budgets are pretty low comparison to what maybe the Brand Pharmaceutical Association. Sure. Like one campaign of theirs would be our whole year budget. Wow. So we have to work a lot smarter and not harder. And so it really is constantly going out and trying to figure out what the emerging channels are, what people are using, really using social listening to make sure that we're using our time effectively.
I love that. It's kind of like Field of Dreams. Like it's not, if you build it, they will come. That's not how it works anymore, right? No. If you build a really nice website or you build this really nice infographic, it doesn't work like where, people are just going to come to it. Yeah, there's a chance that you might kind of go viral, but, you have to be at the right time in the right channels with the right format to go viral now. It doesn't work.
Timing and relevancy is everything, right?
Yeah. And then, and then where do those other promotional channels fit in, or just paid promotion that's really targeted to the right people? Where do those types of things fit in? I always kind of keep telling us, because we run programs, and sometimes the easiest thing to do is just create another program. Like, oh, someone has a great idea, let's just create it. But it's like, okay, well, where's the community for that? Where's the audience? We're always thinking a little bit more than, all right, that's a great idea, but how are we going to get people, there? How are we going to really engage our core folks? So you've won an innovation award for the Public Affairs Council, but that's not all of the innovative work that you've done. What are some kind of innovative campaigns that you've recently run? Can you give us a little bit of background into
that? Sure. We recently won. I'll tell just a little bit about that. We won for our happy 35 years of generics. And what we did is really try to create an experience for that one. So what we did is we used online social media, and then we created an offline experience when we could be in person. Sure. We set up 2 tents outside the Capitol building in DC. And what we did was hand out 1,500 Georgetown cupcakes, and we had T-shirts on celebrating 35 years of generic medicines. And then we handed out a card that really talked about the benefits of generics, the savings of generics, and then a little bit of advocacy on the other side of the card that connected with a campaign that we were doing. And so that was really, why was it groundbreaking? I mean, we really connected the social, we had a hashtag HB2 generics. And so we actually delivered boxes to the Orrin Hatch, it's the Hatch-Waxman, it was that was signed 35 years ago that really started the generics industry. So we sent them a box of cupcakes, and then we had them take a picture and tweet it out. So it was really trying to work with influencers, social influencers, trying to understand who those people are that were already champions and really getting them to create that social buzz to get people sharing. And of course, cupcakes, help. Like no one's not going to take a free, and you might not know Georgetown cupcakes if you don't live in this area, but I don't think many people are going to turn down Georgetown cupcake if you're walking by. So that was one. And I guess I would just jump to another one we did, because we also represent the biosimilar medicines, which are competitors to the biologics. And those are normally given out in hospitals. They're liquid-based, injectables. They treat, cancer and many of life-saving medicines for many people. And when we wanted to build awareness about biosimilars, most people know what generics are already, so you can kind of talk about their benefits. But this was a little bit more of an education campaign for people to even understand what biosimilars were. And so we were thinking, and this was the very beginning of when the pandemic started, and we're like, we're not going to be able to do an in-person giveaway cupcakes. How can we take that to an online environment and make something viral to get people to share? And so I think one of the tips I would say to people is, when you're working in an association, doesn't mean you need to ignore what people are doing on the commercial side. So many times I'm looking at Nike, I'm looking at Facebook, I'm looking at Google, Amazon. I mean, they have teams of creative people and some of the largest agencies that are out there coming up with these amazing ideas. And I think it was actually at a public affairs conference when we won the award. I was on the panel, and I kind of gave a test to the audience and said, if we were going to do something for biosimilars and we're going to do like a virtual card, what would we do? And so we had an organization that I already had worked with called Social Driver came up and said, hey, we've done this before, where we did an augmented reality lens where we created this experience that will work on Snapchat and Instagram, and people would share it. And so I'm like, it's a virtual card that kind of pops out. And they're like, yeah, haven't you ever done it? And you swiped and you put, flowers on your hair or changed your face to look young. That's augmented reality. And it's actually fairly economical to create, which you would think, that costs billions of dollars. No, and you can actually do it yourself through your own Facebook tools. But we had them help us out, and we envisioned a card that if you put your mobile phone over this anniversary card that would be online or on social media, that would pop out in all these hexagons and showed, kind of the process of biosimilars. So it'd be like microscopes and complex things, very science guy kind of material. And then if they clicked, they went to a website that really talked about what biosimilars were and that they've been around for 10 years and all the potential billions in savings that these could bring to the US. So that was really fun. And if you turned it on your face, there was another experience, and people shared that virally. So it was just one way where we spent a really minimal cost, and we still have that lens or app if you go to our Instagram page. So it lasted beyond the campaign. The other things that we've done, a piece of legislation that we actually had huge success on was fixing the USMCA, which is the trade agreement. And that's kind of like, you think, how do you engage and rally people in the United States over something that's happening on trade agreements with Mexico and Canada? But as you know, there's a lot of patients that are concerned about the cost of their drugs and want to import drugs from other countries. So we already had their attention, and we worked with some other allies and partners to put together a campaign called Fix USMCA. And what we did was create an infographic with a rock climber. And the rock climber would just kind of climb up all these obstacles to the top of a mountain where there was a flag that would basically be accessible meds for all. And what we did was build a storyline around that rock climber. So he would go out into it was just motion graphic videos of this rock climber that would talk through, what were the challenges. And at the end, after probably a 2-year battle of putting out this content marketing and kind of engaging videos and people sharing them, that we ended up fixing the USA, and all the provisions that our team recommended were accepted. So that was a way where an animated rock climber changed legislation. So I think motion graphics and video, if people aren't using it already. It's just such an easy platform for people to kind of create and share.
Yeah, it's like gone are the days of the static kind of infographic. It's now all motion, and it gets it gets you thinking, and it shows you on an actual journey. Like you said, it's a little bit more narrative driven. Did he have a name, or she have a name?
That's a good question.
No, we didn't. But for Halloween, I have to admit, I did dress up as the rock climber, and I did win like the community award.
I love it. I love it. I mean, it sounds like it all comes. So all of these seem to have that generic. Hey, look at that. The general undercurrent, right, of a good story, and of sort of that elevator pitch, which you started us on. Finding that elevator pitch seems to be the number. I mean, that's what you started the conversation on, which was simply, hey, we represent the drugs that are less expensive for you to use, and we'll do the job just the same. And right, like that's sort of your way to bridge the gap from A to B. It's a loaded question, but like, how do you find? What would you suggest to people who are looking for that elevator pitch? It's not as easy necessarily as just this is it. It's more of what are some of the steps you might take to figure out what that underlying current is that you then want to build all these stories from?
Right. Well, I mean, that's a great question, because at a lot of organizations I've worked at, you have people sitting in a conference room trying to figure that out, right? And they're usually not the consumers. So I would say, number one, listen to your consumers or your advocates. They are commenting on social media, or ask them. And a lot of times that will help plant the seed. It's surprisingly how brilliant those people can be, or you can take a seed of that and build something. And so, I think it comes down to creating that experience. And as I said, with the cupcakes, as I said, with the digital and the camera, but it needs to be something kind of new and innovative that people want to play with, because if they've done it 100 times already, they're like, oh, I've already done that. Or if it's not really easy and it takes more work and they can't understand, it really needs to be like one click and it works.
Sure.
So I would say that, sometimes it's, one, you have to be willing to take a risk and try out new things. So I think going to conferences, there's so many that I go all the time, because when I get there, I get inspired. You hear from other organizations. So whether it's the Public Affairs Council, Advocacy Conference, the Digital Conference, I've gone to the Adobe conferences before. Just because you're in an association too, like I said, don't discount and don't go to other conferences that are huge, like South by Southwest.
Yeah.
And if you can take and hear just from people talking about those platforms, look at the trends of what's happening in the next 5 years, that, they're going to be correct. So right now they would say, publishing and authorship, is on the horizon. Virtual events, as we all know, are a big thing. So how could your campaign include a virtual or digital event platform? And how can you create that to be engaging as a real life person-to-person experience?
So follow up for that is the generics, obviously, and biosimilars. There's a whole humongous community for it, obviously, but I think one of the challenges, or at least that I see on the outside potentially, is just the age gaps, right? For those folks that you hear about potentially driving to Canada for lower price drugs, that's typically sort of like the older crowd versus the younger. So how do you sort of segment that message? And you don't imagine sort of my parents on TikTok or something like that. That's not going to happen. So how do you sort of segment and think through then sort of both the innovative side of obviously getting new people in the door to understand generics, to understand the good that you're doing, versus then, continuing to engage those that are slightly older that don't get it, but still are part of the process. And, obviously we want to be mindful of both. And the cupcakes do a great job of bridging the gap. Yes, absolutely. But digitally, what are you sort of thinking about in those realms?
Well, I think you have to use those channels. Even people are always like, my grandmother's not going to be on Facebook. I'm like, well, actually,
yeah, right.
My mother-in-law is one of the most active on Facebook. So I think, it might be, there's a trust thing. I think when you look at the older generations, the younger generations are a little more understandable. They understand that even if they are, this digital marketing is, or this is an ad, that it helps. because it's personalizing their experience and showing them things that might be relevant to them. So I would say lately in our last campaign, which was Secure Our Meds, we really went out to we know people that are on Capitol Hill, we might not actually be reaching the actual lawmaker, the senator, the representative. We're probably going to be we're really marketing to the Capitol Hill staffers. And those are a younger generation and demographic. And so we used Instagram stories, and we used interactive polling and quizzes. So I don't know if you use them, but the whole Instagram and Facebook, choose yes or no, the interactive stories. People just like kind of silly things and interactive things. And so they're not passive. You're getting them to click something. And so we use that where we just did general information about the savings to educate people about generics. And we tried to put things out there that was surprising. Did you know that, generics are saving patients $6 million a week? I mean, 6 million.
The Mythbusters thing, absolutely.
Not billion, 6 million a week, or 313 billion a year was the stat last year. And then, that just gets people to be if it's yes or no, and they choose no, and then your answer is no, true, click here to find out more. So I think you have to engage. And then we also, as another channel, did ads on Spotify. And so the ads were more to a younger audience. They're kind of upbeat, and they're you would be surprised. Did you know this fact? That, trying to talk in just plain language to people. Sure. I know I listen to Spotify when I'm running, and you know how they play those ads over and over again. But if it's an interactive quiz and it's allowing me to guess the answer, I'm a little bit more apt to kind of test my knowledge. Yeah. And I think that this new generation, as well as my generation, I don't want people to force feed me an ad and tell me what to do. I actually want information to then make my own decision. So I think education and content marketing, putting that in channels that are more new, really can help any type of advocacy. It doesn't have to be generic medicines.
That's really smart.
Go ahead, Nick.
Well, I have a selfish question. I know AAM's recently launched a podcast. How are you kind of marketing that, and how do you plan on making sure that there's so many podcasts out there that people are listening in?
I know I feel like we're a little behind the curve, because I feel like I've been saying this for the last 5 years I've been here. We have to do podcasts, but I think during the challenging times we've had with many people remote, and really having the extra time to be walking and listening to podcasts, they've really picked up, even though it's a channel that's been there for forever, it seems like. So we launched AAM All Access, and we're lucky that our CEO, Dan Leonard, comes from a communications background. And so he's great on air. And so he wants to dig in and ask hard questions to people to our industry. And I think it allows us to take issues and topics that normally are kind of in the weeds and allow to ask those deeper questions. I think the format is absolutely perfect, because if you're really trying to understand something like, why do we need to fix the USMCA? Most of the time, that's not in 2 sentences on a Facebook ad. So I think that when you can get thought-provoking questions out there, and it's so specific to our industry, and it's open mic, and it's important, and to discuss areas about public health, I think people are looking for that kind of platform. And we're inviting not only people from the generics and biosimilars industry, but thought leaders, legislators, academics, scientists, anyone that has a story to share. And it's surprising how quickly that format gets picked up by the media. It's just, I know there's many out there, but if you're really talking about advocacy on a podcast, I don't know if I know that many that are specific to healthcare podcasts that are out there. And so when you can intersect healthcare and medicines and talk about accessibility to care and the science and innovation, you'll definitely have listeners. And just with our first podcast, we launched it on Podbean. We put up about 3 or 4 just because we wanted to make sure we had some out there to be official. And we put the first one out and we had over 600 page views on the AAM blog. We just had my CEO launch it through his LinkedIn Facebook page, and he wrote an article, and we had 152 downloads, and that was in the first couple of days.
That's great.
And they also found the other ones, because when you go to listen to a podcast, it'll say next up. So then we were seeing like the Generics Bulletin and other media outlets and the trade publications picking it up and already tweeting about our other ones. So we were like, okay, well, I mean, it works. So yes, I think it is a busy marketplace, but I think that when you want to have deeper conversations and you need the experts to really be talking about it, I think it is a good platform, and people will share it if it has important information in it. And our job is to translate complex things to make them more simple. So
yeah, you've really touched on sort of plain language. I think in everything that we've talked about today, in terms of both the elevator pitch to listening to your advocates to don't shying away from channels, right? The idea is, our job as advocacy professionals is to break down the complex messages of what's happening into ridiculously easy, digestible pieces. And I think that's where a lot of advocacy channels go wrong. And I'd love to get your feeling on that too, is not breaking it down, putting out the 10-page PDF and then wondering why they're not getting anywhere. And so, how would you talk to somebody else in the industry who was having a tough time, maybe just with their CEO who wasn't willing to break it down to something easier, or just couldn't find the right way to do that?
Well, for me, and probably because I've lived in the digital marketing world, is the analytics are the best. You can't go in, you can talk and you can ask, and people are going to just have their own beliefs. Sure. So I think there's a case where digital is a great platform because you can easily test messages. So when I first came here, there was some old thinking. We work very highly collaboratively with our state and federal affairs team, as well as our scientific and regulatory team. And they feel like they need to include every nuance and detail. And so we would say, okay, well, we'll try your message. Sure. Sounds good. I'm not going to argue with you. I'm not the expert. We're going to put that out there. We're going to A/B test that message with something as simple as protect your low-cost generics. There is legislation right now that may impact what you pay, period. Click here. I mean, and which one is going to get them to click through? That there's some bill name and some, another, complicated thing that they're even confused whether it even is going to impact them. But I also believe in the facts and the truth. We even do like hashtag RX facts that we put out there. We have a whole blog on facts that we put out because we want to not hide information. We don't want to put a direct response email out there to someone and say they need to do this because we say to do it. We want to go out there and tell them that there's something happening right now and read this. And then here you can take action right here. Right. We've made a nice little message that they can customize, that we invite you to customize. Sure. It's even better if you customize and send your lawmaker right now. So I don't do well with direct response emails. I look at the subject line and I'm just like, skip, delete.
I know. I mean, I love the idea of testing it. I've worked at other associations where, especially when you want to just make like a statement that's powerful, then the lawyers get a hold of it and, they're like, actually, we need, 4 or 5 footnotes and you really can't say this and you can't, and so it's like, okay, well, we're communicating to, who our audience is not a courtroom, right? We're making a statement here. And, if it's based in fact, we should be able to say it. We can get the details out on our website. We can get the details out, elsewhere, not in this infographic or not in this, Twitter card. And sometimes that's a really fun conversation to have when you go back and forth. And it's nice that you can prove, okay, who clicked on what.
Yeah, and you got to be playful and fun. But yeah, as a CEO, they're probably like, no, we can't do that, But I mean, people, the first step is to get them engaged. And so a lot of times you need to get something, to get an emotional impact out of them. And to me, it's not always the negative. I find the positive, like the happy birthday cupcake or celebration, people more apt to get involved in. I think right now people are just exhausted by misery. So if you could share stories, share fun things. People just want like to share a meme, like they don't want to get too deep in it. But I think you also don't it's also very planful. I think you have to be careful about the words you choose and understand that, most of the time, all day long, people are Googling something. So I was actually this weekend, I celebrated my birthday in West Virginia at a cabin that I thought I would have Wi-Fi. No. And I can't tell you how many times in our conversation that we didn't pick up our phone and try to Google something because we wanted to learn it more.
Sure.
And so you always have to be looking at that too. I think where you are in the search results, creating content that's that simple. You've seen Google, like one of the first things we put out was a blog that was like, what is the difference between generics and brands? We got picked up by Google, and that is still the number one most page visited on our website. So just really that education, bringing it back to what you think someone's going to search for that will then maybe bring up your content. And then you don't have to use paid advertising, which again is kind of getting restricted and a lot of people don't trust. I think, putting out good content and then getting the viral or organic sharing of it, asking people, and don't forget to ask people, because if you just put something out there and you don't say, if you share this, this could help this, then people will take that next step. And I learned that in some of the work I did at St. Jude and nonprofit and fundraising. I mean, people power is real. Communities of people are real, and people do want to help and make a better world. So you got to tap into that. The positive.
It's so powerful. I love it's something I tell folks all the time is, I was a legislative assistant in Capitol Hill, and I knew very little about what a lot of folks were coming in to lobby me on. And so what did I do? I used CRS and I used all these other tools that I had, but I also just Googled who was coming in to see me, what those organizations kind of stood for. And then I just Googled what people were saying about that issue. I wanted to see news stories or blog pieces, or I wanted to see, both sides. And then you must be at that top kind of couple of results or someone else's opinion or someone else's, policy position is going to be there. You're going to be buried on page 2, which I think, only 5% of people ever make it to page 2 on Google search results.
Well, and these days, especially, right? I think that the stat is now 60%, more than half of searches result in 0 clicks, right? And so if you're not putting out content that's getting picked up, 1, in the special side box, but 2, at least in the top result or 2 with a good, simple execution of what the excerpt is, then, you're missing your opportunity, especially in your niche issues where, nobody else may be writing about this. And so just writing just as simple as you say, what is the difference, or what do we do, or what is this, can be enough to get you there. And that's fantastic. I love that that's as easy as it was. I mean, granted, there's a lot that goes into it, but just in terms of putting out that blog post, getting others to link to it, and being the resource for exactly what that means.
Yeah, and getting experts and training your experts, or choosing experts to speak, that are comfortable with the subject matter, because I think people gravitate to those experts too. It's not the CEO talking or the association talking. People are looking for that person on Twitter to just put out their 2 cents, right? And that's just 1 sentence, basically, with a graph. And so we do try to elevate our experts and get their voice out there. It's very important. And I think that connects better with people because they can look back, look at their bio, see who they are, and really trust. I mean, it all comes down to trust and reputation, right?
Yeah. Yeah. I love that. So let's talk innovation for a second, right? It starts with the story. It starts with getting people to better understand who you are and what you're doing and those kind of things. What is that next? And you mentioned the Fix USMCA. Fantastic. Love it. What's sort of the next frontier that you're thinking about right now?
So we're looking right before when are we going to stop talking about the pandemic? But it keeps milestone dates here. We launched a campaign called Doesn't Add Up. And it was a play on consumers paying out-of-pocket costs at the pharmacy. So what a generic manufacturer might make, how much a pill costs is very different than when you walk to a pharmacy and pick up the price. I mean, there's just so many people in the supply chain.
Sure.
So the Doesn't Add Up campaign was about looking at this very long receipt and being like, what? Like, why should my generics be costing more than, I am now paying like $100 for my eye drops. Like, that's crazy. And so that is a campaign we are going to kind of push out again in a little different way. We actually use rideshare ads. I think people are back in Ubers and Lyfts now on Capitol Hill, but there are some creative ways. And when you're there, you can take a quiz or get information on ride shares. So we saw a lot of success on that, and also an effort, Man on the Street, we call it. I think other people kind of call it that, where you go in and people are at their pharmacy and they come out of the pharmacy and you just ask them a question and you put that on tape. So we call it the Man on the Street. So we're going to do that because I do think real people, you could do what you want with like stock imagery, it is what it is. But when you have testimonials from real patients, I think it helps in all cases, whether it's a positive message, like I just walked out of my pharmacy and I've been paying the same amount for my generic medicine. It's great. Lawmakers, please don't do anything to change that. Or them getting kind of mad, why is this happening? Lawmakers need to dig into this and help fix this. And so this is going to be a campaign that we're working on, whether or not it's all in person or partly remote. We have the technology now. Right now, you can go to our website and share your story through one click. You can upload your video or hit record right from our website, and you can record anything. So I think technology, like I said, that one click, making it really easy for people to share things. I think storytelling is a really big part, and they're big influencers in any legislation that we put out there. And it doesn't have to be them being educated about that bit of legislation. They just need to put some pressure and hopefully be in the state of, if it's a state legislation. So they're in that state. That's a patient, that's a constituent that cares. And then our job is to put that in the hands of the lawmaker that's making the decisions.
I love it.
I love this because it's so it's very authentic, and and I think just your kind of approach is really audience centric. It's not AAM, the think tank. I know you have that policy expertise there, but your job isn't to just publish PDF reports, right? It's how do we make this truly, to borrow your term, accessible, right? Like, how do we make this issue available to folks and meet them where they are, not where we necessarily think they should be. I'm sure I have a master's in public policy. I'm sure you work with a bunch of people that have law degrees or public policy backgrounds, right? And it's like, we don't necessarily make fantastic communicators, to our relatives and to the people who might be impacted by these things. And so I think your kind of approach is really smart. Do you and this kind of leads me to kind of a final question is, are you seeing advocacy and kind of marketing converge? Are you seeing these kind of two, I know sometimes we even talk about brand advocacy from the corporate side. Do you see these two areas kind of, interlocking and becoming closer together?
Yeah. And it's, being in marketing and brand marketing, which is where I like to sit, because I do think that storytelling is a really big part of any product that you're selling, any industry you're selling. Everything you're selling comes down to, the brand and reinforcing the brand and your reputation and that trust. And so we actually just put out a new report called Voices in Access report, which we'll be doing now every year in the spring. And what it does is actually formalize, and this has a lot to do with what, as marketers, what we're doing is we're going out there and we're talking to patients, and then we're capturing their stories, and then we're putting it in a publication that will now be put out annually. And so I think that marketing and advocacy is converging, because what's interesting in that report, if you just put that out from like the brand level, oh, I like this industry, or I'm a big fan, I take generic drugs and I trust my drugs, that's one level. What we did was then take that report, it's Voices of Access. And then we linked on the bottom of it what they were saying, we linked it to kind of an advocacy issue. so-and-so would be paying more for their copay if they didn't have this, or here's an opportunity where this could even be better. And so is now really bridging that between who you are and what you do and how it's impacting people's lives. And I think what you have to do is always connect that what can lawmakers do to make it better? Yeah. And they're more apt to read it if they can resonate, because they're all patients too. So if they're reading a story and they're like, oh, that's my dad or that's my mom. Oh, well, I don't want to do anything that's going to impact their Medicare Part D plan, So the more interested to get involved and learn about it.
This has been fantastic. And I think both AAM and the generics industry and patients as well are lucky to have you kind of helping them navigate this space. I know Brian probably has a ton of notes on this.
Another page full of notes, as always. I really like that last one that you mentioned too, just in terms of the idea that, we're getting back to everybody is a patient of something, right? We all have a medical something going on, right? And that doesn't stop when somebody walks into a congressional office or walks onto a Senate floor or walks wherever they are, right? They too either have friends and family or themselves have something where they're taking some sort of drug. And so I think that's a great part too, is to look at the underlying sort of commonalities there that you've done. And you said, look, it doesn't just end here, right? And make it so that it's approachable and then put the real data next to it. I love that, of the myth buster kind of concept of like, here's the great story, side box that says, Susan here would be paying X dollars more if this bill passes or something like that. I think that's fantastic. And your other comment too, of just I go back to the plain language concept, which is the undercurrent of the podcast. Great to break it down. Undercurrent of the messaging, the advocacy sites, undercurrent of everything else. Those two for me are just so a necessity in our industry. Of, as Nick says, how can we break out of the masters of public policy mindset of just, we're really good at understanding issues and really good at working how the policy works, but not necessarily how the people come and understand it. And so I love your perspective on all of that. Nick, any parting words from you?
I just want to thank Erica I know she's super busy and appreciate her time, and hopefully you can tune in to her podcast. Erica, do you want to just pitch the AAM's podcast?
Yeah, it's called AAM All Access, and you could just go to accessiblemeds.org and there will be links to the podcast from there. We're also can be found on Podbean. You can look on iTunes, Spotify. It's a real podcast. We're growing, so please consider getting on, just like here, and just talking. It's really a platform. The more that people can share their perspective and others can resonate with that, I think we're out there educating people. So thank you both for this opportunity to get on and talk a little bit about what we're doing. And hopefully I'll talk to you a year from now. We'll have 10 more things to share. So
in person at the Public Affairs Council Advocacy Conference next year.
Absolutely.
Yes. Well, Erica, thanks again. Nick, thank you as always for co-hosting and having such great insight and questions from your side of things. Again, I'm Brian Fratkin. Thanks again for joining us on the Advocacy Help Desk. Andy Polk will be back soon. I know a lot of folks miss him, but in his ever mindset, one other pitch, of course, is the PAC jobs board, pac.org/jobs. Always, if you're industry, take a look. But otherwise, as Andy would say, keep advocating.